Do y'all know what happens when we tap like this, just bilateral stimulation? What happens in the brain? Who knows? It emotionally regulates whoever. Exposure? Yeah, like exposes the problem for what it is instead of keeping that person stuck in the emotional part of the brain. So for those of you that have done trauma-informed care or are informed about trauma, you know, we got our thinking cap up here, right? This is where we do all of our thinking, linear thinking. Got to get up, go to work, got to pick up some milk on the way home, drop the kids off from school, drop the kids off at 4-H, whatever. This is your linear everyday thinking cap. You open it up. This is the midbrain, the emotional part of the brain. As soon as someone has personality disorder and they start that push-pull or narcissism or any of that stuff, where do we function from? The midbrain. And if we bilaterally tap, it pulls us back up into the thinking brain, where we can then begin to think about it from a point where problems turn into not transference and countertransference, but just problems that all clients and patients have. And then we can see and use the case presentation to work through it, not from the emotional place, but from a thinking observation place. Now, in some folks, when it's a severe personality disorder, what happens to our amygdala? The amygdala is that fire detector smoke alarm that's right there in the mid-emotional brain. What happens to the amygdala? It starts firing off. And when it fires off, we flip our lid. We don't think at all. We're in survival mode. We're not just in emotional mode, we are in survival mode. How helpful is a supervisee to a client in survival mode? Not at all. So again, the time he or she spends with you, if you can get them to practice this bilateral tapping and close their eyes while just contemplating their issues about that client, it'll pull them out of that limbic straight into the thinking cap, and they'll then come out, and you want to count at least to 120 or 180 seconds, 2 to 3 minutes, to give them time to pull out of that and start processing it in their thinking cap. It's a great tool. So also what happens for anybody who's doing counseling and they're with a very difficult client, when that amygdala sounds off and we're very emotional about that and our thinking cap's not on anymore, the hindbrain begins to pick up that signal from the amygdala and the emotional brain. The hindbrain controls our heart, our respiration, our muscles. What happens when we get overactivated by a client? What happens to us physically? What does our heart do? It starts racing, yes. What happens to our breath? Very shallow and rapid. If you stay like that as a counselor through seeing clients all day, what happens by evening? You are exhausted, and you won't last 37 years. You won't last 5 years. So it's really important to keep that in mind, that we've got to practice throughout our day a relaxation response. Get out, walk around the building. Take a client and walk around the building if it's appropriate, and they're fine with that. I remember at ADAC, we used to hike down to the women's prison and around that loop, and more women could talk about what was really going on in that hike. I mean, this was group therapy, so it was 12 at the most, but usually about 8. And we stayed pretty clustered. And just that movement, you know what we say in NA and AA? Move a muscle, change a thought. Yes. So movement not only helps your clients, it can help you as a supervisee or a supervisor. Going for a walk with your supervisee. If you live in a place or have a practice in a place where it's safe to walk and it's fairly confidential. Movement is important, really understanding why the client's in treatment, the diagnosis, helping your supervisee to come out of that transference or countertransference and be present in the case presentation. That's why I always start with the pretzel, and we'll practice that in a few minutes, because by the time supervisees get to my office, they've just left work, they've been seeing clients, they're hurrying to me, they may or may not have eaten lunch, and they're sitting down and they're harrowed at that point, right? Look a little frazzled. So when we pretzel up, I guess I should go ahead and teach it. Most of you know it anyway. When we pretzel up, crossing extremities into midline, it slows the heart, slows the breath, and brings the cardiac and neurological system back to a slower baseline, which then slows down digestion and everything else. It impacts every system in the body. All right, so let's do the pretzel. How many of you already know the pretzel or the hookup from that brain gym? More than half. Good. It's getting out there. All right, so get comfortable in your chair. So you'll need to push back just a little bit probably. And I'm going to present this standing up. You're not supposed to stand up. One time I was presenting this standing up, and everybody stood up, and I went, oh, no, I'm just standing. You sit. All right, so we have anybody left-handed in here? Lefties. Oh, good gracious. That's the most I've ever had. Excellent. So if you're left-handed, when I say right, you'll use your left, but I'll coach you around that as well. So if you're right-handed, it's right ankle over left. If you're left-handed, it's left ankle over right. And then arms out in front of you. And as a little kid said to me the other day, Miss Linda, like a zombie? I said, yes, like a zombie, but your palms facing, not like this, like this. Don't you love kids? They'll just like pipe right up. And I went, I love this kid. All right, palms facing. Now turn your thumbs down, hands back to back, palms out. Right over left or left over right. Lace your fingers, drop them down, and bring that up to your chest. Now, if that's too tight, you can loosen up and just cross fingertips. If you're with a patient that isn't flexible, you can just have them cross their hands down like this. All right, so you're in that. The next step is we're going to do 4 breaths, because breaths can really help activate the parasympathetic nervous system, which is the part of the nervous system that puts the brake on the heart and the breathing and really slows the brain and body down. So we're going to start with a deep breath in the nose. The exhale will be nice and slow through pursed lips, really to extend the exhale. So a deep breath in the nose, and then slowly out through pursed lips like you're blowing out a candle far away. And we're going to do 4 of those. A second one. And slowly out through pursed lips. And if you're comfortable, you can close your eyes. If not, just look down and soften your gaze. And if you're actually doing this with a patient or client, I don't recommend closing your eyes. I knew they'd get a chuckle. Now, if it's a client you know and you feel safe, you could do that. But if you work in the emergency room at Mission or Park Ridge or Cherokee, don't. Another deep breath in the nose. And out through pursed lips. Just letting your shoulders drop. And a 4th, breathe in the nose. And out through pursed lips. And again, just leaving your eyes closed or looking down and softening your gaze. I'm going to count up to 120 seconds, which is 2 minutes. It takes about 2 minutes for the nervous system and the heart to respond. And during this time, I want you to think a pleasant thought. Think about a pleasant thought over the last few days, weeks, or months. Perhaps that beautiful snow we had, perhaps a holiday memory with friends or family, or just a day you were with your pet hiking or going for a walk, and just revisit that pleasant memory and what made it so special. And as you breathe normally now, I'll bring us out in 2 minutes. And with a nice deep breath, when you're ready, begin to relax your arms down and open your eyes. Oh, it was nice to hear some sighs. Yes. So what did you notice? What changed? If anything? Calming. Centering. Anybody else? Gratitude came up for you. Very nice. Anything?
Thoughts changed. I was supposed to be thinking about that peaceful thing, but then it went off into something else.
Okay. Was that positive, though? Was it pleasant when it went off, or was it indicating something that needed attention?
Well, it was something that I was trying to remember earlier today, and it came back. It came to a part of it came back.
A part of that came back. So you tried to think about something pleasant, but then your mind wandered off to something you were trying to remember earlier, and partially that came back. So your brain actually, with rest, went back to attend to what it missed earlier. The human brain. Isn't it incredible? If we give our brain pause, if we give our body pause, we return to homeostasis. We return to balance and peace and our core values of compassion and acceptance and understanding and patience. So that's probably the quickest you can obtain a relaxation response. And that's just 2 minutes. And think about if you do that 3 or 4 times a day, how that will change your life and your practice of psychotherapy or supervision. And remembering what we really started with is teaching this and doing this with a supervisee when they come into your office or you go to their office, so that you can both decompress, let go of the day, and show up authentic and present. Isn't that great? Plus the benefit of the relaxation response. Yes, Roy?
The mind will always go back to thinking or mapping out some strategy or just distracting itself from the quiet place. And so when that happens, I just get both things and I go back to whatever the breath is.
Right. So I like your technique. So what you're describing is you'll go into that peaceful place, but then the mind wants to take off in another direction. Is just thanking the mind for doing that and then coming back. Yeah. And that's part of the technique to bring it back to a peaceful place. But also it's a way of the mind saying what's not been attended to that you can work on. And the technique also is to have a piece of paper in front of you so you can open your eyes and write that down and then go back to the quiet place. But that crossing the extremities across midline like that sends a gentle stimulation to right and left hemisphere, here in the top of the brain, just a nice gentle stimulation. And it's like taking the brain and going, rock-a-bye baby in the treetop. And the brain loves that gentle stimulation. And when the brain loves that gentle stimulation, then it begins to slow and relax all the systems of the body, which then gets us back on board. How many of y'all have got kids in school? And I think one of the things they're teaching in school, other than belly breathing to bring calm, is they're teaching them about the 3-part brain. They're talking about there's the top of the brain is like a wise old owl. This is your wisdom, your thinking, your wisdom, your wise old owl. And when the inside of the brain here, the amygdala, it's like a dog. When it gets upset and it barks, it scares the owl and it flies away. So if we bring calm to the barking dog, the wise old owl will return. Do you like that? Yeah, I learned that the other day from a kid too. I'm telling you, kids are my teacher right now. So, and she was really, the problem was they didn't teach them how to stop the barking dog other than the belly breathing. So she's going to go back and teach them the pretzel. I thought your teacher will be impressed. So, let's see, I'm trying to think. We started at 8:30, 9:30, so 15 minutes we'll take a break. Y'all doing good? All right, because I know I've talked a lot. So moving on from problem statement to treatment goals. And again, that's identifying and reminding that supervisee, what are you working towards with this client? 9 times out of 10, when I ask that question, they have to really think about what they're working on because they've forgotten it because they were so focused on the problem. So really bringing back those goals and saying, let's kind of take a look at those goals. Do they still apply? If those goals were created 90 days ago or a month ago, things may have changed for that client, and helping our supervisees reevaluate those goals in the room with you right now, and then reevaluating those with the client is real important. And then moving on to barriers to treatment and client success. You put a star beside this one because this is really what is going to help you begin to hash out with that supervisee what's getting in the way of that client meeting their treatment goals. Now, what are some of the barriers to treatment goals? I think one of the biggest is housing in Western North Carolina. What's another one? What's another barrier to them? Transportation, housing, what else? Employment. Now, and how many folks know about, there is a list circulating of felony-friendly hiring agencies? So if you don't have that, throw your hand up if you've got a copy of that you want to share if anybody were to contact you. Or where do we get that now? It started when I was at ADAC, so it's pretty old. Get it at the employment office, felony-friendly, at the employment security office? Okay, good. So there's your good resource. And to have those available to share with supervisees. See, that's psychoed, is providing resources and referrals. And we better have some heating fuel assistance resources for our supervisees to share with clients because it's been a really cold winter here in Western North Carolina. And it's pretty scary, the cost of what people are having to endure. So what are other barriers? What? Family issues, yes. If that person is in addiction treatment, are they staying with family members that are actively using? Then we've got to look at housing or getting them in the treatment or a halfway house or something to get them out of that environment. Yes?
Stage of readiness?
The stage of readiness, yeah. Sometimes we want to push clients quicker than they want to move, right? Change is on whose timetable? Theirs. So, looking at how their readiness for change can be a barrier if what we're wanting is different than what the client is wanting or needing. Other barriers to client success or treatment. Yes, ma'am. Medical problems. Yes, helping them get medical care and getting medications. Because some clients don't have Medicaid, Medicare, or insurance, and being able to access medications. So what we're describing is a resource list, right, that we can give to supervisees or invite supervisees to start creating that and do that with them or have them go back to their agency and start asking around, does our agency have a resource list? If so, how do I get that? I know when I worked at October Road as a clinical director, we developed one, put it online where everybody could have access to it, but we had to keep that updated as well. But we also need to print that out and give it to a client because they don't all have access to computers or ways to access that information. So being able to have that printout available. All right, let's move on to any countertransference. I've got number 7 twice there. Any countertransference. Why do we need to ask that during a case presentation? Yeah, to create insight and awareness with that supervisee. And we might not use the word countertransference because that kind of brings up, no, not me. It's like, an STD or something, Countertransference, no, not me. We might say, so when you sit down with that client, do any issues come up for you? Like they remind you of someone you've known before or, they can't possibly understand me. They're too old or they're too young. What comes up when you're with a supervisee and when a supervisee is with a client? And just asking it in ways that are disarming, that don't, have judgment or blame or shame. And you can couch it with saying, everybody has issues come up. Recently I had a supervisee that was coming in for supervision, and I hadn't met him before, and this was like a cold call. I'm always amazed that people will choose me as their supervisor, and they've never met me. I mean, this is a pretty personal relationship. I would want to interview somebody. I want to see their face. I want to get their vibe. So anyway, this guy comes in, and first thing I do is I Google you. I'll find out who's showing up, that I'm going to be, supervising. And I was kind of shocked. He's pretty famous, musician. And I was like, woo, like, how am I going to supervise this dude who's like moving from a career in music to becoming a counselor? And he's like known nationally, and he's just moved to Asheville. And I'm like, this is too much. I could feel the countertransference, that energy of, oh, this person is. And when he showed up, he was the most humble person I've ever met in my life. And I think it's going to be a great relationship. But it is almost important not to Google to see who people are, because then we get impressions, and that's not always who they really are. It was really helpful to meet him one-on-one, and and then he said something about, can I bring the guitar and play for it sometime? I went, well, probably not a good idea. Right up front, but yes, I would love to hear you at some point, hear your music. But when he said that, I had kind of that reaction, and I think he read that and he asked me about that later. And I said, well, there's a part of me that wants to keep the relationship clean. And, he said, well, it hurt my feelings. And I thought, oh boy, here we are already, transference, countertransference. And I said, well, it wasn't my intention to hurt your feelings. What came up for me reminded me actually of ADAC. Amy and I worked at ADAC together. Anybody else been at ADAC with Amy and I back in the old days, and George Leroy and Susie? Do y'all remember the guy that played the saxophone? He's still in Asheville. Wow. The very first time we let him bring the saxophone to ADAC, it was chaos. We had to limit when he played it, and we were doing it because we knew music was therapeutic for him. And that was part of his recovery and how he supported himself. It was also how he bought his drug.